The following portion of Studio 512 is sponsored by Doctors PR. Okay, y'all, today we're diving into a big issue in men's health, how ED can affect a man's confidence and what can be done. Studies estimate that about 20% of men of all ages are affected, and those percentages are rising with age. Now, a non-surgical drug-free treatment is available that targets the root cause of ED rather than just masking symptoms with pills. Joining us is Dr. Vincent Esparza of Persona Healthcare in Austin, who is treating patients with the new Apex RF device by InMode. So, Dr. Esparza, first question for you. What are the leading causes of ED in men, including younger men?
Yeah, so the causes of ED are multifactorial. A lot of the causes could be in younger men. A lot of them tend to be more mentally causing, but what we're really targeting here is those patients with chronic diseases, patients who have known vascular illness, things like diabetes, high blood pressure, cholesterol, and heart disease.
All right, let's talk about Apex RF. That's kind of new here to the market, cutting edge, right?
Right, yes.
And how it works.
Yeah, so absolutely. So Apex RF was released by InMode. They're well known within the industry. And it was released at the end of 2024, early 2025. Before that, they were doing some studies, but the way it predominantly works is it uses RF frequency technology, which is just fancy for radiofrequency technology. And what they found is that by heating the tissue to a very specific temperature, you can actually stimulate the growth of new blood vessels.
Let's talk about the Apex RF treatment and how it compares to shockwave therapy, which I've definitely heard about in the last few years.
Absolutely. So shockwave therapy came out a couple of years ago, and the idea is that by creating special vibrations within the tissue, you could release some of the chemical messengers that stimulate the production of new blood vessels. Apex RF does not have any medication use, and so it is really a safer option, and it is completely painless. So it takes about 20 minutes. We do one session every week for roughly 6 weeks to 12 weeks, depending on how the patient likes the performance, and if they want to continue to see if there's an improvement in performance. There's no need for anesthesia, no type of numbing or anything like that, just some sonographic gel and the conduction.
Well, this has been a sensitive subject, of course, to talk about. It's not always the first thing that people want to stick their hands up and say, hey, I need a little help with.
Absolutely.
So if someone's interested in learning a little bit more, what should they do?
Yeah, absolutely. So I'd be happy to talk to anybody. You can go online at personahealthcareclinic.com. So fortunately, with known histories of this issue, insurance companies have allowed for patients who have opted into a free spending account or health saving account to utilize it for this treatment. I'd love to talk to anyone about their issue and see if maybe Apex RF is the right option for them.
Sounds good to me, doctor.
Okay.
Thank you for your time.
Thank you. Thank you.
Learn more at personahealthcareclinic.com. The preceding portion of Studio 512 was sponsored by Doctors PR.